Hi, I am Dr. Yulo, Oneplant consultant and tea doctor. Today, I will demonstrate to you the two types of impression making. With this, you will be familiarized with the components of the prosthetic part. With the use of our model cast and the materials that we're going to use, you will be able to easily understand the proper way of impression making. So let's proceed. So you need to fit the tray on your patient's mouth in order for you to locate or where to put the hole on your pickup type of impression making. Okay. So with this, we will demonstrate to you the two types of impression making, the open type and the closed type. Okay. Fit the tray. From there, you can mark where you can put the hole for your open type of impression making. So let's say if this is your patient's mouth, so it should be on the other side. So you can get the mirror and just mark on where you will make an opening for your pickup type of impression. So with your slow speed, let's make the hole. So you fit the tray again, there. So you can see where you will put your impression coping. Okay. So with the use of your hex driver, you remove the healing abutment. Okay. 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 So fit the tray. Okay. Now we're gonna use, this is the pickup type of impression coping. So there is a pin and the coping. Okay. Put there. Okay. Make sure that your coping is properly engaged on your fixture. Then, with your finger, you tighten the pin. Make sure it's properly engaged. Okay. There. Now we're gonna do another type of impression technique, which is the closed type or the transfer type of impression technique. So you also have two parts, the pin and the coping. So you insert the pin. There. With this closed type, you will notice that there is a flat surface. So this flat surface will indicate where you will put upon the removal of the scoping and put it or put it at the impression. So flat surface. Okay.
Flat surface.
Yeah, this is a
front,
flat surface
for the front.
front. Yeah. So you can, so it will be visible. The flat surface, you will know where is the flat surface located. So put it at the visible side. Okay. There. There. Make sure again that it's properly fitted on your fixture. Okay. With your finger, you tighten it clockwise. Okay. There. See the flat surface. Flat surface. Here. Tight. Fixed. Okay. Now you fit the tray. There. You can see, you will notice on the open type, the pin extends on your tray. Okay. This is for you to remove it upon setting of your impression material. Okay. Okay. Now the impression material that we're going to use, this is the light body. Light body. Okay. So this will get the detailed part of the soft tissues. Okay. Together with this, we will use the heavy body. So there are two types. It's either the putty or also using the gun type. But we're going to use the putty type. Okay. There. We have the base and the catalyst. The type of impression material we're going to use is an silicon material, which is hydrophilic, meaning it's more stable, so it is more accurate impression material that we will use today. Okay. Color indicated, use catalyst. Okay. So you proportion for the whole tray. Your finger or your hands should be clean and don't use gloves upon mixing of this putty material. The reason for it is that you will retard or delay the setting of your impression material. Okay. So with this, you mixed it. There. Okay. Mixture should be homogeneous, so you get more accurate impression. There. Hit it. There, see? Okay. Good. Now we use the light body. This will get the detailed part of your soft tissue. Okay. Okay. Okay, which put, very good. All right, you remove the excess on the tray so that you will expose the pin for your pickup type of impression. I mean the transfer type. We have to unscrew first. There.
To be edited.
Screw. There, good. There. So you can see the pickup type goes with the impression material. There. So this is the transfer type. The coping remains on the patient's mouth. Okay. So with this, you get the analog. Okay. Put it there. There. Okay. And then tighten it. There. Okay. For the close type, you remove the coping. Yeah. Okay. Remove the coping. Get the analog. You connect. Okay. There. Make sure it's properly engaged. So there. See the flat surface? Goes with the flat surface at the front. That's why you should put the flat surface where it is visible for you for easy location. Okay. You put and snug there. So those are the two types of impression technique. And then send this to the lab. The lab will pour the stone. They will make a gum replica for this, appearing like this one. Like this. It's a gum replica. Okay. Right? So send this to the lab. And the lab will pour. And when they return it, it's gonna be like this. Okay. So the analog replicates your implant. So whatever the size of your implant, the same size of your analog. Okay. So the purpose of the transfer coping is that it gets the orientation of your implant from the patient's mouth, transferring it on a model cast, in which the laboratory will fabricate your crown from here. Okay. From the impression part, you will get the size of your abutment. So whatever the cuff size of your healing abutment, that coincides with the cuff size of your top abutment, like this part. Yeah. This is the one piece. Yeah. So, no? So there's a abutment with file. Say file. I won't file, just showing only. File. If it's high, you can modify your abutment. Okay. The advantage of the open type or the pickup type is that no need for you to remove and then put it back again. So this is more accurate impression. But the disadvantage of this is that it is difficult to put because it has a pin, and especially if you're working on the posterior side, so you don't have enough access on this, right? Especially if you're gonna remove it. So difficult access, especially if you're working more on the posterior side. Okay. Nevertheless, since you're not removing the coping, so there's less inaccuracy of your placement. But with the transfer type, together with the analog, where's the analog? Together with the analog, yeah, here. You have to put on the same side where the flat surface is, on that flat surface of your impression material. So you can see where's the flat surface there. See, that's the flat surface. Yeah. So that's why you need to put the flat surface on the side which is visible for easy location on how to put your transfer coping exactly on your impression. So there, back, and then it will snap there. Okay. Advantage of this is that it is easier for placement compared to the open type. See, okay. So this is the open type. The access is difficult, especially if you're working on the posterior side. So your patient needs to open his mouth more widely. And since you're using the hex driver, it's very difficult to put the screw to tighten or untighten it. Once it's tightened, and then just remove it from the patient's mouth. Okay?